So welcome back. We're here with Dr. Diarmuid McCoy, Specialist Pain Medicine Physician. And in this video tutorial, we're going to be looking at that mysterious condition known as Complex Regional Pain Syndrome, or CRPS. So Dr. McCoy, what is this all about?
Well, it is a mysterious condition. It was actually first described properly in the American Civil War, and that was a war in which firearms were used, and those injured by those firearms tend to have a better chance of recovery if they didn't die of the injury. And there were many descriptions of nerve injuries that caused these horrendous pain conditions associated with highly sensitive limbs and hands and toes following that nerve injury. And it was called initially causalgia because there was a cause and it was a pain condition associated with that cause. This wasn't a very good description, and eventually it evolved into two different types of what we now describe as complex regional pain syndrome. It used to be called reflex sympathetic dystrophy or dystrophic pain syndrome, and various other titles, but we like to use the term that probably describes it best: complex regional pain syndrome. More recently, there have been definitions made for it, and a group of pain specialists, neurologists, neurosurgeons, and rehabilitation physicians met a number of years ago in Budapest and came up with what is known as the Budapest criteria for the diagnosis of complex regional pain syndrome. The symptoms are broad and many. They're associated with pain, with sweating, with color change, temperature changes depending on the environment and the time of day, blood flow abnormalities, swelling, and actually dystrophic changes, in other words, changes of the way the skin, the hair, and the nails behave. And therefore, it's not just pain, but also a collection of symptoms or a syndrome associated with other symptoms in addition to the pain. It's generally thought that it involves the nervous system, the blood flow, the vascular system, the immune system is almost certainly involved, and a complex of immune chemicals, not only at the site of the injury, but in the central nervous system, is also of great importance. The treatments for it can be many and varied. They have been tried, a whole variety of them, down through the years with varying success. But generally, if you can decrease the patient's pain so that they can start imitating normal function in whatever way they can, it is more likely to resolve. At best, the symptoms can be mild and evolve and disappear in a reasonable period of time over a number of months. At worst, the symptoms can be so severe that an amputation has to be considered. So it is a mysterious disease, it is a complex disease, and it is difficult to manage. The patients, of course, don't understand why it has occurred and become very distressed because of it. And back to the whole concept of the psychosocial biomedical approach, with the pain specialist being central to that approach, and an early intervention and early referral is required.
So with complex regional pain syndrome, is it possible that it appears without a particular cause or an identifiable cause?
That has been described. In fact, it has been described following stroke, following bypass surgery. But in general, it occurs in an area that has been injured. That injury may be so trivial as to be one that the patient doesn't even notice, or it can be very, very severe and dominate the patient's life. But the complex regional pain syndrome that follows can become extremely severe even after what might be described as a trivial injury. It also can spread from one limb to another. This is an unusual occurrence, but one that is well documented. And even though we call it a regional syndrome, there are systemic, in other words, all body changes, such as blood pressure changes, temperature changes, balance, etc. And that is why this disease is well named complex.
And has, out of any of the research, have they identified any areas of commonality or any particular cluster of precursor conditions that tend to have an increased likelihood of complex regional pain syndrome developing? Or does it tend to be just a random presentation?
We would like to think that we've identified a nerve injury, either partial or complete, as being central to its development. But there are a large minority of patients in whom this cannot be identified. An infection can be the cause, a crush injury, an amputation, or a strain can be as little as is required to cause the pain, and yet the pain can be well out of proportion to the inciting event. And it does need careful documentation, careful examination, and careful listening to the patient and their presenting symptoms, the distress associated, and the dysfunction that it causes the patient, putting all of these things together to come up with a plan of action.
So for a case manager who might be listening to this tutorial, or a lawyer, what kinds of words would a patient or an injured individual be likely to say that could give them an indication that what they're listening to, or what the person has experienced, what they're hearing them say, could be an indication of complex regional pain syndrome?
If we have a constellation of symptoms which include color changes, temperature changes, hypersensitivity, that is, a sensitivity or experience of pain well out of proportion to what might cause pain, such as little as a draft or a breeze or a touch, can herald the onset of complex regional pain syndrome. It is not unique to the syndrome, but it can be associated. Certainly swelling, temperature changes and sweating changes are cardinal symptoms. And if these are part of what the patient presents with and reports, then a rapid referral to a specialist pain medicine physician is appropriate.
Fascinating. Well, thank you so much, Dr. McCoy, for shedding light on this, as you said, very mysterious condition. The next topic we're going to be looking at is a topic around seeing the pain and radiology. When would you use different kinds of imaging? On which occasions? What would that show to us? So hope you'll all come back. Thank you, Dr. McCoy.
Great. Thank you.